Welcome to Business Connection. I'm Liz Spencer. We have a wonderful guest in studio today. We have Dr. Silvia Hood Washington. She's a naturopathic doctor and chief lymphatic clinician and owner of Naturopaths for Lymphatic Wellness. Welcome, doctor.
I'm so glad to be here. Thank you.
So tell me first, let's start, what is the lymphatic system, and tell me a little bit about how it gets damaged. I don't think we think much about it.
Well, the lymphatic system is a major system that helps us heal. And the lymphatic system is actually, it's described as like the sewage system of the body. It helps clean up bacteria, viruses. It helps protect us against any kind of injury, traumatic injury, if you had like your leg is crushed, or if you just go in and have cosmetic surgery and it's elective injury. Its job is to make the system reset. So you have all this fluid leaking out of our blood vessels from our veins and our arteries, and that leaking fluid becomes lymphatic fluid. And it's processed through lymphatic regional nodes. And everybody knows when they get sick, like, oh I have swollen lymph nodes in my neck. That's the lymphatic system trying to protect you against. We know that, trying to protect us against infection. But actually it's like a spider web, and it's all over our body. 2 levels, a very superficial level right under the skin, and a deep level right around the stomach. So again, it's part of our immune system. It's part of our system that helps us recover from injury and disease.
So when we ask about how it gets damaged, what role does obesity play in that damaging?
So imagine we had a stream, a beautiful flowing stream, Fox River or the DuPage River. And we know about dams. Just imagine the entire river stream being stopped by dams. The flow stops. The lymphatic fluid sort of follows the path of our venous system, the blood coming back to the heart. And what we want to do is we want to keep that system flowing upward back to the heart and is being clean. If we damage it, we're putting huge dams, stones, and so it can't flow, and that fluid backs up. Now, the lymphatic fluid is different than like a regular swelling. You just think it's a bunch of like excess water. A lymph fluid actually has protein in it. So when that protein-rich fluid is backed up, the body actually becomes very hard. And in advanced cases, there's like stages 0, 1, 2, 3. 0, you feel a little heavy, it's backing up. But stage 2 and 3, the body actually becomes hard and actually deformed in its physical appearance. At some point in time, the fluid will actually, being dammed and blocked, will start seeping through the skin and causing gaping ulcers. And eventually it can lead to amputation, certain types of lymphatic cancer that they've already identified through like the studies.
Wow, that doesn't sound pleasant at all.
No, in fact, some people can think about their lymphatic flow being disrupted, like when they take a plane and they're sitting still, they're not moving, right. And that you have a backup of venous flow and lymphatic flow. So that's where they're telling people, put on your compression stockings, your garments when you fly, because you're not moving around and that fluid is not being able to return back to the heart. So it's a very serious situation when that system is damaged. And then people who have cancer, they know about lymphatic risks, because in order to control cancer, they're removing lymph nodes sometimes. And so suddenly it's like the piping in your house, the water piping. If you start cutting out pipes, right, the water won't flow in certain parts of the house. And so then that will back it up. So whenever the system is damaged, whether by removing parts of it, by blocking it, and obesity does that. Obesity, the weight of the fatty tissue is like those huge rocks in the dam. And so it's pressing on the lymphatic vessels and lymphatic capillaries, and it's backing up. And now the physicians who are doing research know that obesity is creating what they call secondary lymphedema.
Wow. Wow. Why is it important for somebody with this condition to see a certified therapist like yourself?
Well, the manual lymphatic drainage technique, which certified lymphatic therapists are taught, is a specialized training. And so we're taught how to move that lymphatic fluid with a certain pressure and a certain movement. And we do it in such a way as if we're mapping out the body. A certified lymphatic therapist will look at your health history, they will look at your physical body, and they will see where those blockages are on the body. And they will move that fluid back into a path that it returns back to the heart. If we press too hard, right, on those lymphatic vessels and capillaries, which are very sensitive, then we can actually damage them. And so you'll actually damage a patient by not moving it at the right pressure and in the right direction. A certified lymphatic therapist, I'm Close trained. Gunter Close came from Germany in 1987. He's basically training the physical therapist, occupational therapist for over 135 hours of how to move the fluid, how to understand anatomy and physiology, and do it in such a way that they know medically will not damage the patient, but actually return them to health. And most importantly, a certified lymphatic therapist who's ethical will give their patient the proper amount of time on the table. Mm-hmm. A patient cannot have manual lymphatic drainage and decongest that lymphatic flow if that patient is not on that table, really ideally for 60 minutes. That's moving fluid, 60 minutes. And then we also know as certified lymphatic therapists that once we move the fluid out, we actually have to tape their bodies or wrap their bodies or make sure that the bodies have compression garments so that fluid doesn't rush back in. Why would you take a toilet and clean out your toilet, right? It's now flowing, it's not overflowing anymore, and then dump a gallon of trash back into it? Well, that's what they do when they move lymphatic fluid and not tape, wrap, or compress their patients. They're actually hurting them.
How do people find someone like yourself? How do they begin that research?
The best way to get a person who knows how to move out congested lymphatic fluid is to go to the Lymphatic Association of North America, LANA.org, and type in your zip code, and you will find a certified lymphatic therapist who's internationally registered. Now, to be internationally registered, you have to take a board exam. I'm a CLT LANA therapist, so I sat for my 3-hour exam after completing my hundreds of hours of lymphatic training by one of the handful of lymphatic therapy schools in the United States. If you want someone who's educated and vetted and demonstrating that they know how to move the fluid and tape and wrap, you should go to that site and find your therapist with a zip code, with your proper zip code.
That's wonderful. You're very passionate about this. Why?
Well, there is one other way in which a person can develop lymphatic disorders. It's called primary lymphedema. So secondary was obesity. Having surgeries would create secondary lymphedema. But I'm one of those lucky souls who was born with a missing or deficient lymphatic system. I have a very rare form of lymphedema called lymphedema distichiasis. That means that not only is my lymphatic system deformed from birth, but I also have other vasculature systems that were compromised, cardiovascular. I don't have the same kind of heart health that you would have. I have double and triple lashes, which can cause a lot of damage to the eye. So sometimes we have to pluck out 40 lashes. In my case, when I became pregnant, my pregnancies were at a higher risk because my body couldn't clear the excess fluid. So I've been suffering from birth, more susceptibility to infection and disease, a lot of food allergies. The lymphatic system is part of the immune system. So when you're born without it, especially as a child, you're going to be struggling with, recurrent infections, swelling, and as you get older and having children, complicated pregnancies. And then as you progress, higher risk for diabetes, higher risk for obesity, higher risk for high blood pressure, because your whole vascular system is not the same as a person born with everything intact. We were blessed.
So that has given you a whole mission for life.
Every day I have to wear compression garments. So it breaks my heart because I know that with a lymphatic disorder, I have to have my lymphatic fluid moved and I must be in compression. And so when my patients come in and it's heartbreaking and they haven't been diagnosed, it's like, why do I have so much pain? and I help them move the fluid off. And then I make sure, I love kinesiology taping for lymphatic drainage because a lot of people don't wear the heavy garments. It's a blessing to see the relief off someone else's body and to be able to understand what they're suffering from and reduce that level of pain and discomfort.
Thank you for taking time to stop by and share this important information that everybody who has this needs to know, and more importantly, to advocate for finding the proper treatment for everybody. So thank you very much for stopping by. We're going to be right back with more Business Connection. Stay tuned.